One doesn't usually think of airway when they come and talk to me about their jaw joint, but what we repeatedly see is that when the tongue is trapped in a mouth that's too small for it, it has nowhere else to go but either into the throat or over the top of the teeth. And once I talk to my patients about this, they start saying, you know, come to think of it, I don't know where to put my tongue, or my tongue feels too big for my mouth. So if that's how you're feeling, let's take it a little further. What I also see is that when the tongue sits in the back of the throat, it creates a difficulty in breathing. So what people will do is they'll put their head up in order to keep the airway open, but you can't walk around that way, so we bring our head forward, and hence bad posture. I often hear people say, oh, my mother or my sister or whoever always tells me I have bad posture. I hold my stress in my shoulders because they're always sore. And I would debate you and say that I bet it's instead not that you hold your stress there, but because you have to hold your head, which is a heavy, like 10-pound bowling ball, off axis, all these muscles have to work overtime in order to support you from your head falling off. In addition, we often think that we have a muscle spasm here because it feels so tight, but typically that's actually not a spasm, but an overstretched muscle. As you're sitting like this, these muscles are overshortened, and these are overstretched. So it feels like a really, really hard lump. But actually what it's like is if you took a rubber band and you stretched it as hard as you possibly can, it would feel hard if you pushed on it. You may not be one of those people who puts your tongue in your airway. Many people instead put their tongue over their teeth. So when I ask them to bite down, I can actually see their tongue sit between their upper and lower teeth. That's not where the tongue belongs. When you swallow, the tongue should touch the hard palate right behind your front teeth. And the teeth should be able to touch when you swallow, and there should not be a tongue there. If the tongue does not go in the proper position, what that does is it irritates muscles that have to control the tongue. So for a moment, if you take your fingers and you feel here and you move your tongue around, you'll feel that those muscles are activated. So sometimes my patients will come in and tell me, I have swollen glands or I'm sore down here. That's a tongue muscle. In addition, when the tongue isn't going where it belongs, it's not holding the teeth where they belong. So if the tongue sits down low, the teeth tend to cave over. If the tongue sits up where it belongs, that's what keeps that upper jaw in its nice, spacious position. Ideally, an upper arch would be nice and broad like this one. Often, people come to us with an upper arch that looks like this. We call this a V-shaped arch. So imagine if you were the tongue, how much more room you have if you've got a full-shaped arch. In addition, if you had a restricted upper jaw, that it would force the lower jaw back and it couldn't fit where it needs to. What we do is we want to grow the upper jaw to fit the tongue, and another benefit of that is to give a better lip support. So many times people will tell me that they don't like their nose, that their nose looks too big, or that they notice that their jaw seems too small. But this can often be corrected by developing the upper jaw. If I can give us a bigger upper jaw, then the lower jaw will follow suit. We know that the lower face should be a certain space forward to the forehead in order to look beautiful and function beautifully. Here's an illustration of Kate Winslet. You can see how gorgeous she looks from the side. And one of the things that makes her so beautiful is her beautiful profile. Here's also Grace Kelly, and again you can see how her face is full ahead of her forehead. But typically people will come in and their face is lined up or behind their forehead, which means that they have, again, less room for their tongue. And when you have less room for your tongue, you have it sitting in your airway or over your teeth. And if that's the case, it goes into the whole sequela of having neck pain, jaw pain, ear fullness, airway problems, which could even lead to sleep apnea in a later period of one's life. Here's an appliance that we like to make. It's called a growth appliance. On the side of this appliance is a little coil spring. And what we do is once a month we see you and we activate the coil spring, and what that in turn does is it puts pressure on this whole upper section in the front. And what we see is an absolute beautiful development of the full potential of the upper jaw. As the upper jaw grows, the lower jaw will typically come along for the ride.